Hey everyone, welcome to the Brain Body Reset Podcast. I'm your host, Spencer Zimmerman. Beyond the diagnosis and symptoms, there's a path to feeling better. Dive into the world of brain-body connection and learn how to optimize your health. All right, everyone, another week. We are going to cover some great information tonight, all about dizziness. Remember though, this is about you. So if you've got questions, even if it's not on dizziness, go ahead, ask them in the comments, because we're trying to empower you so you can take control of your health and you can actually get the care you need. Too many people unfortunately struggle for months and even years to get answers. And it's because they don't know where to look and they don't know what questions to ask. So highly encourage you, please comment. Let me know any questions that you may have. And, please make sure to subscribe if you haven't subscribed to the YouTube channel. All right. So when we talk about dizziness, what do you think about when you think of dizziness? Is it, I'm dizzy, I feel lightheaded, I feel off balance, maybe things are rocking back and forth or shifting on me? Or maybe some of you think, well, I'm dizzy, but things are spinning. How do you describe dizziness? Now that's going to be different for each and every one of you, but what are your thoughts on dizziness? All right. As I said, if you've got questions, please comment, let me know. And if you're watching a replay of this, I'll come back later to those and we will do future ones off that. All right. So when we look at dizziness, I'm going to share with you a framework that we want to go over with us. All right, here we go. When we look at dizziness, dizziness is ultimately a brain issue. Yes, dizziness is related to the brain. Without the brain, there is no dizziness. Now, underneath this umbrella of the brain, I want you to understand there are four big things that we need to understand. One is that inflammation can create dizziness. Not only inflammation in the brain, but inflammation from the body that impacts the brain. Don't worry, we are going to dive into that more. Next, brain connections. If your brain isn't connecting appropriately or it's receiving bad information from another part of the body, such as your neck, your eyes, or other things, which we'll talk about this in more detail as well, that can also cause dizziness. Metabolic issues, so how well your neurons and the cells in your body function and if they're being impacted, right? Like blood sugar and things like that. Or mitochondrial dysfunction. So mitochondria are known as the energy producers of the cell. If mitochondria are unhealthy, then having dizziness, but even more issues than that are very common, right? Maybe it's chronic pain. Maybe it's brain fog. Maybe it's word finding and other things like that. And lastly, blood flow or oxygen changes within the brain are also going to be a driver of dizziness. Now, some of you, dizziness is brand new. Others, you've been dealing with dizziness for months and years. And so we are going to go through a framework. We've already established that dizziness is a brain-based issue, and we are going to dive in a little bit deeper than this, though. Once again, please leave us comments. What questions do you have? Because this is about you. I want you to be able to take care of your health so you can have the future you want. All right, here we go. Now we are going to do a deep dive. All right, here we go. So everyone should be able to see that. Okay, so this is the framework of dizziness. Now, before I do this, I'm going to answer the question that came in. What is the difference between vertigo and dizziness? A lot of people use these two words interchangeably. They'll come into my office. I'm like, what's going on? Well, I've got vertigo. Now, this is super important because a lot of people are using these words interchangeably, and they are definitely not the same thing. And if you're using the wrong word, you may not actually get the help you're looking for. For example, when we talk about vertigo, vertigo is a rotational sensation. Either you are spinning or the world is spinning around you. Now, that's important. You need to know the difference because, for example, the inner ear crystals get blamed all the time for vertigo. But if you tell me you are the one that's spinning and it's not the world, it's really not going to be the inner ear crystals. Also, how long does the spinning last for? Is it something that lasts for 30 seconds, 45 seconds? Hey, you know what? Pretty good chance it could actually be those inner ear crystals. But if you're telling me you've got vertigo episodes with spinning that's lasting hours, that doesn't fit the pattern of inner ear crystals. And it's super important. This may seem nuanced, but this is how you get the help you need. And unfortunately, many providers, they absolutely hate treating dizziness and vertigo because they themselves never got the education they needed on it. And they just don't know anything better than to say, okay, here's your meclizine. Please take it, move on. We don't know what else to do for you. So there are definitely knowing the difference is super important. Whereas dizziness, right? So we said vertigo, spinning sensation. What's dizziness? Dizziness is really just feeling off balance. For some people, they'll say, I'm shifting side to side, or I watch something go by and I just get off balance. I get a little lightheaded. Maybe you have a rocking back and forward motion. Those are different things that people use for dizziness. And based upon if it's dizziness or vertigo, you are actually going different paths from a workup perspective. Certain things become higher priority, other things start going down. All right, so now we've got our map. So zoom in if you need to, but dizziness. When we look at dizziness, ultimately we've said this is a brain-based issue because if you don't have a brain, you will not have dizziness. You have neurological causes of dizziness. You have inflammatory causes of dizziness. You have metabolic causes of dizziness. You have musculoskeletal causes of dizziness and vascular. So we could definitely put way more on this than what we did. But hey, you know what? That's what we are going to start with. Once again, if you've got questions, let me know because I want to make sure you get the most out of this. And if at any point you want to learn more information or work with me, feel free to check out my website. All right. So let's start with inflammatory. When we look at inflammation, now this inflammation is a super vague word because everyone's like, I've got inflammation. I've got inflammation. You're right. A lot of people do. Now you have to say, what is driving the inflammation? Well, here's some different things to consider. You could literally have dizziness due to the foods you are eating. If the foods you're eating are ultra processed, create issues with your blood sugar and other things like that, you can get dizziness. Gluten can give you dizziness. I've had patients where all they do is go gluten free. And guess what? The dizziness that they've been dealing with for months and years is gone. You can have infections that drive dizziness. You can have allergies. Yes, seasonal allergies. How many of you get seasonal allergies and you get all this buildup in your eustachian tube and now you don't feel as stable? You feel off balance. That can cause dizziness. Mold allergies and issues with mold can definitely cause dizziness as well. But when we're looking at this, of these things, really the only one that's routinely checked in my experience with dizziness, it's going to be the allergies, usually the seasonal allergies. Outside of that, they're really not looking other places. With vertigo, though, depending on what's explained, they can actually look at infections. But outside of it, they tend to not look into infections a lot. All right, we are going to go to metabolic. So metabolic is the rate of how everything functions in the body. So if you impact the rate of function, you ultimately can slow it down. You slow down function, you can create dizziness, brain fog, fatigue, and a wide variety of other things. So anemia, iron deficiency, B vitamin deficiencies, this can cause dizziness. Now, this is really big, especially for females, from early on with menstruating all the way through even in a menopause. And guys, you can even get anemia as well. So make sure you're getting this checked. And you're probably thinking, well, how do I even get this checked? Well, I'm going to tell you. When we look at anemia from an iron perspective, you should really get a good iron panel. Most people, when they get anemia checked, they're only getting a CBC, which is a complete blood count looking at the red blood cells. And they're trying to say, okay, well, your red blood cells look good. You can't have anemia. Well, you can have normal red blood cells and still have iron deficiency, which is going to create dizziness. Now, the things that are going to tip you off when you're looking at your CBC is you've got what's called your MC series. So when you look at your labs, see MCV, MCHC, RDW, and things like that. When those, for example, the MCs go low, that's a big hint that you've got iron issues. But if it goes high, that's a big hint you've actually got B vitamin issues, specifically B12. Now, how do you actually narrow this down? Well, you do a full iron panel. Ferritin, for example, is the body's stored form of iron. Where's your ferritin at? I get a lot of people who come in, they're iron deficient, their ferritin's 15, maybe a 20 if they're lucky. But we're looking at those markers: ferritin, TIBC, total iron binding capacity, iron saturation, serum iron. Those are what's needed. Don't just get a serum iron on its own. A serum iron on its own is pretty much garbage. It's a flimsy number that fluctuates pretty rapidly, and it's not going to give you the best idea of what's fully going on. So everyone following with me. If you've got questions, please make sure you're asking me the questions. I'm going in and out between here and also looking at Instagram. So if people are commenting on there, so I can answer them. So please go ahead. All right. So everyone doing good so far. Awesome. Next, thyroid. Thyroid can impact metabolic function as well. Most people think of thyroid, oh, I'm fatigued, I'm gaining weight, it's hard to lose weight. They're thinking about it from that perspective. But if thyroid function's off, you can ultimately lead to dizziness as well. So what should you have checked on thyroid? TSH, this is how your brain tells your thyroid to produce. When thyroid's starting to suffer, that number is going to go up. But you should also look at free and total T3 and T4. Free T3 is the body's free usable form of thyroid. If that's low, that's going to be an issue. Lastly, if you do have thyroid issues, you need to be checked for autoimmunity to your thyroid, which is done using TPO and thyroglobulin antibodies. Not going to go into that anymore. That's a whole nother conversation on working through thyroid, getting the help you need. All right. Next, blood sugar. So I hope this is making sense for everyone. Let me know what you're learning. Blood sugar. So this is actually one of the few things that's routinely checked when people are dealing with dizziness. Okay. Allergies checked. Blood sugar also pretty routinely going to be checked. Anemia, I wish I could say it was routinely checked, but I get so many females who come in with anemia and they are not being checked. It's just, honestly, it's really frustrating because it's an easy test to do. It's not expensive, but yet it's not done. Blood sugar. Blood sugar that either goes too low or too high, both can create dizziness. Now, you can get your blood sugar right, you can get a finger prick. Where's your blood sugar at? If it's in the 70s, could possibly cause dizziness. For sure in the 60s and below, much, very likely. On the other end, if it's high, if it's above 130, 140, if you're a diabetic, you may even be in the 200 range. That can definitely cause dizziness. Now, your blood sugar doesn't have to be severely off for some people to have dizziness. You think about all these things, the anemia, thyroid, blood sugar. Dizziness is a brain-based issue. All of these things can impact how your brain's functioning and impact the metabolic function and rate of your brain cells. When those are off, if you have a susceptible brain-based system for dizziness, then this can tip you over into it. So don't downplay it if it's not severely off. Last thing we're going to say on blood sugar. You don't even have to get a blood test. Just when you eat food, just think about it. What happens to your energy? Do you get more energy? Right? Do you wake up, or are you ready to crash and go into a food coma? Well, either one of those tell you your blood sugar is off. If you go into a food coma, it's because your blood sugar's too high. And if you're getting more energy, it's usually because your blood sugar's been too low. So know what's happening with that. Okay. And if you want to check your blood sugar markers, check other things beyond a fasting glucose. Get an A1C, get a C-peptide, get an insulin. Know what's happening there. All right. So we've pretty thoroughly covered metabolic. Now, I get it. There's always more we could add, but we are going to leave it at that. Musculoskeletal. You can have dizziness due to problems with your musculoskeletal system, specifically your cervical spine and the muscles there. Bad information from your neck to your brain can lead to dizziness. That's why some people go to chiropractic, physical therapy, massage, acupuncture, get any of that stuff done in their neck, and they're like, wow, man, I did that, and my dizziness is doing so much better. It's because your muscles and your joints are sending bad information to your brain. Your brain's not sure what to do, and you ultimately end up with dizziness. So that's something to consider. Now, on the same token, while that can help it, it can also make it worse. So awesome for those of you that do those and you feel better. But if you feel worse, know that it can actually be too much input, and you've got to say, well, what's going on? And if you're getting routinely adjusted or physical therapy and nothing's holding, I want you to think higher up. Cervical spine, think about the brain. The brain controls it. Okay. And we'll go into more of that in a little bit. Next, vascular system. Having issues with your cardiovascular system. This is also another one that's routinely checked. Specifically, low blood pressure, low heart rate, or high blood pressure, right? Any of these issues can contribute to dizziness. So what are the things routinely checked again? Allergies, if it's the right time of year, blood sugar, and vascular. And then the other thing I didn't say, which I've got right here, water. Are you hydrated? Because if you're not hydrated, that also is going to. But those are really the basics of what everyone's checking with dizziness, which is great if that's what you've got. But if you've got something that's more complicated than that, then do you really expect to get better? All right. Okay, we got another question. Is there a certain diet to help with dizziness? Well, yes and no, right? Everything's a little nuanced. There's everyone wants black and white. But if we look at this, we say, what's going to support our blood sugar? If you eat things, super processed foods, you love your Coca-Cola, right? Your Pepsi, your McDonald's, you eat things that drive up your blood sugar, then guess what? That's going to contribute to your dizziness. It's also highly inflammatory. So those would be things I'd say to avoid. So if you eat things that help to keep your blood sugar good, more like a paleo style diet, for example, and for those not familiar with the term paleo is basically more primitive. So let's imagine what are things that you can eat and cook that are minimally processed. Fruits, vegetables, meat, fish, nuts, seeds, and good fats. It doesn't demonize.
If you're finding this information valuable, please share this podcast with others and give us a 5-star review, as that is the only way this podcast grows. Please continue listening and keep enjoying.
Really anything. Okay. Yes, it's not a big fan of grains. It's not a big fan of dairy. But when we look at the other stuff, most people that do a paleo style diet and they're getting lots of veggies, because the average American is drastically under consuming the amount of fiber, just massively under consuming. The other thing is the average American is also massively under consuming the amount of protein. You need protein for muscle synthesis, okay, to build muscle. But also, guess what? If you don't get enough protein as you age, you're already going to lose muscle mass. But it can speed up because you're not getting enough. So please make sure you're getting enough protein. For some people, that's actually 0.8 to 1 grams per pound of body weight. So you've got to really go up there. And it does take some dedicated effort. And that's why many people that used to intermittent fast, who are health influencers and providers, they've actually stopped doing that. They've really left it behind because it impacts their ability to get in all their nutrients so much that they just won't do it anymore. So, all right. And then last question we got on this is, can I still drink my coffee? That's a good question. For some people, coffee is going to actually make them have dizziness issues. Coffee can impact your vascular supply and could be a driver of dizziness. Others, it's the things that are added into their coffee. If you're doing sweeteners, creamers, all of that stuff, driving your blood sugar crazy, then you may have to get rid of it. But the biggest thing is be honest with yourself, right? Some people can do a little bit of coffee and it's not that big of a deal. Others, it impacts them. Just be honest with what it is. Don't make more of it. Don't make less of it than what it is. All right. Here we go. Answered all the questions that have come in so far. Remember, if you've got questions, please let me know as we continue this conversation on what causes dizziness. All right, the last one, neurological. So as we said, dizziness ultimately is a neurological brain-based issue. Now, we've talked about a lot of things that impact the nervous system: metabolic issues with anemia, thyroid, and blood sugar, musculoskeletal issues with bad cervical spine input from your joints or your muscles, vascular issues, blood pressure or heart rate, inflammatory things, your foods, infections, allergies, and molds. These all can create inflammation, impact the nervous system, and lead to dizziness. All right, neurological. First, dysautonomia POTS. So dysautonomia means dysregulated autonomic nervous system. Your autonomic nervous system ultimately controls your blood pressure, your heart rate, your respiration, your gastrointestinal system, and things like that. Now, dysautonomia has actually become much more talked about since COVID, because with COVID, as well as the vaccine, we are seeing people get side effects and ultimately cause dysautonomia. Now, depending on the type of dysautonomia, with POTS being the most common, their heart rate actually shoots up when they go from like sitting to standing, and then their blood pressure tanks. That is something that can give people dizziness. Next, visual issues. So if your visual system is off, that can give you dizziness. So if you've sat there and you know you're not moving, but you see other cars moving and you're like, whoa, I feel like my car just rolled and I know I didn't let my foot off the gas, that's a visual system induced dizziness. There are those who also, I get patients all the time, are like, man, I watch stuff go in my background and I get dizzy. That is visual system issue. Next, vestibular. So vestibular gets all the talk is on the inner ears, but there's so much more to the vestibular system than just the inner ears and the crystals. Okay, it goes all the way into the brainstem. Issues with vestibular function can also do that. Everything we've talked about here actually has the ability to impact vestibular function. Next, concussion. Millions and millions of concussions happen every single year. A large number of these actually don't get better despite popular opinion that they do. No, they don't. Research shows they don't. Not only don't they get better, but they don't get education when they're in the ER and they get diagnosed. They don't get follow-ups. And so they're blaming it on other stuff. And ultimately, they're not getting better. Whiplash. If you've been in a car accident, had rapid motion forward and back, side to side, that's a whiplash mechanism. That can impact your cervical spine, leading to dizziness. But also, with a lot of those whiplashes, concussions occur at the same time, ultimately creating a lot of issues. Now, other things, and I don't even want to say more severe. Yes, stroke is more severe than a concussion, but I don't want you to downplay a concussion. So stroke, a brain bleed, or a blockage can also be a driver of dizziness. And yes, that can persist for months and years following the stroke, just like dizziness can persist for months and years following a concussion. And lastly, multiple sclerosis. Multiple sclerosis is also known to cause dizziness as it impacts the fat around the nerves, impacts the speed of transmission. And when that's off, the signals aren't relayed appropriately. That can create dizziness. So, what questions do you have? I know we went very, very in depth on dizziness. We've looked at it from it being a brain-based issue and then talked about how issues with the metabolics, the musculoskeletal, the vascular, inflammation, and lastly, neurological-based issues, things that directly impact neurology, such as concussion, whiplash, stroke, but also things that indirectly, as we've said, with anemia, thyroid, mold, and other things like that, all can drive dizziness. We also talked about how vertigo and dizziness are not the same. We took questions on nutrition. And if you found this useful, no matter when you're watching this, please comment, let me know. Also, let me know what other questions you have, because the only way I keep doing this is if people find it beneficial. I want you, no matter where you live, to be able to get the answers you need. And I get it. For most of you, you'll never even talk to me in person. But I want you to be able to ask your providers the right questions. And here's what I'm going to leave it at. I always get asked, well, what question should I ask my provider? Well, I've given you a ton. But really, if your provider needs your help to dissect it to this level, they're not the right provider for you. I get it. We overthink providers and what they're capable of. Like, don't ask me about surgery stuff. I don't do surgeries. Ask me about this. This is what I'm great at. But we often think a doctor, because they're a doctor, has to be fantastic at everything medical, when it's not true. Let them be great where they're good, but also, know when it's not the right thing, because they're not the right person for that. All right. Once again, I trust everyone found this useful. Until next time, this is Dr. Z. I'm the Brain Guy.
If you have found the material valuable, please subscribe to my YouTube channel, Dr. Spencer Zimmerman, and leave us a 5-star review on Apple Podcasts or where you normally listen to podcasts from. If you would like to work with me, visit peakbrainandbody.com to learn more. You can find me on YouTube, Instagram, Facebook, or TikTok, all with the handle Dr. Spencer Zimmerman. I'm also on X with the handle Dr. S. Zimmerman 5. This podcast is for general information purposes only and does not constitute the practice of medicine, nursing, or other healthcare professional services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials are to be used at the user's own risk. The content on this podcast is not meant to be a substitution for medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition that they have and should seek the assistance of their healthcare professionals for any such conditions.